Hey everyone, it's Dr. Carl Baird at Evolve Performance Healthcare. Today we are talking about sciatic pain, and in particular, 3 of the most common and critical mistakes that people make when they're trying to overcome sciatic pain that keep you in pain for longer than you need to be. So let's just get right into it. The very first one is overstretching. So I actually run ads for sciatic pain on Google, and they tell you kind of the search terms that people look for when they're looking for help with sciatic pain. Sciatic stretches is always, week after week, #1. And if you're looking for sciatic stretches on Google, you're already on the wrong track. And it goes back to what sciatic pain actually is. Most commonly, it's a disc herniation, or again, your intervertebral discs are like jelly donuts, and when there's too much compression in that, the jelly pops up, put pressure on your nerve root, which sends that sciatic pain down the leg. So it's not a flexibility issue, and overstretching it can actually make it worse. And so that's why it's really important, if you're having sciatic pain, to get assessed, because if your sciatic pain is being caused by a disc herniation, stretching it is going to make it worse and keep you in pain longer. So it's important to really differentiate what is causing your sciatic pain to avoid, again, overstretching it and making it worse. Number 2 is injections and surgery. So if you go the more Western medical route, I can almost guarantee you, if you have sciatic pain of any sort, they're going to recommend an injection or they're going to recommend surgery. Again, very good for short-term relief of sciatic pain, but they conveniently leave out all the long-term complications that come with injections and surgery. They don't tell you that when you inject a steroid in your intervertebral disc, that over the course of time, it actually weakens that disc. So the chance of suffering a second injury gets higher. They don't tell you when you get surgery that you're not just going into the back and you're magically fixed, is that they have to cut through muscle, they have to cut through nerves, you have a recovery, you have missed days off of work. There are all these things that go into getting a surgery that make it, honestly, it should be the last resort for sciatic pain. And the truth is, 95% of sciatic pain can be resolved without surgery. So I would highly, highly recommend that you get a second opinion if you've been recommended injections or surgery. And the very third one is to do nothing. So a lot of people, again, just sit back, wait, and hope it goes away on its own. This is a #1 guarantee to make it go worse, keep you in pain longer than you need to be. And again, eventually, yeah, the pain's going to go away on its own, but at that point, the chance of it coming back is greater because you haven't really done anything to fix it. The body's kind of healed itself, but the things that caused it to happen in the first place are still intact. So there you go. Those are the 3 things that contribute, or mistakes that people make with sciatic pain. So again, #1, overstretching. Important to get assessed because you don't want to stretch something that doesn't need to be stretched. #2, getting an injection and surgery right off the bat without getting a second opinion. And #3 is doing nothing. So I hope that helps. If you're dealing with sciatic pain, you have any questions, comment below. Happy to help. Thanks for watching.